Thousands of UK travellers are heading to Mexico for the 2026 World Cup this summer, and the majority of them will not have had the right health advice before they fly. I'm Harshika, a specialist travel health nurse at Health Klinix, and in this video I'm going to walk you through the vaccinations you may need, the disease you need to know about, and the practical health steps that could be the difference between an incredible trip and a really serious one. Let's start with vaccinations. There are no mandatory vaccines required for UK travellers entering Mexico, but the mandatory and recommended are two entirely different things. Hepatitis A is one of the most important vaccines for any travellers to Mexico. It's a viral infection of the liver spread through contaminated food and water. Symptoms include jaundice, severe fatigue, nausea. It can leave you feeling seriously unwell for weeks and in some cases require hospitalisation. You don't need to be eating street food to be at risk. The virus can be present in restaurant meals, salads, drinks prepared with contaminated water. It's given as a 2-dose vaccine. Typhoid. It's a bacterial infection also spread through contaminated food and water. What makes typhoid particularly dangerous is how it presents. A gradual rising fever, headache, stomach pain that can easily be mistaken for a bad flu. Without treatment, it can progress to life-threatening complications, including intestinal perforation. It's particularly relevant for travellers visiting smaller cities or spending time outside of tourist areas. Measles, mumps and rubella. Measles is one of the most contagious infectious diseases known to medicine. A single infected person in a crowd can transmit it up to 18 unvaccinated individuals. In a stadium of 83,000 fans from countries across the world, the risk is very real. And as of May 2026, over 10,000 measles cases have already been reported in Mexico this year alone. Check that you've had 2 doses. If you're unsure, we can check and vaccinate at your travel health appointment. Diphtheria, polio and tetanus. Boosters should be up to date for any international travels. Tetanus in particular is worth highlighting. The bacteria lives in soil worldwide, and any cut, graze or puncture wound abroad is a potential entry point. Travellers will need a booster if they've not had it in the last 10 years. Hepatitis B. Hepatitis B is spread through infected blood and bodily fluids. The risk of infection is increased if you need any form of medical treatment abroad, even something as minor as stitches. We offer a combined hepatitis A and B vaccine, which means fewer injections and better value than having each one separately. Rabies is present in Mexico, mainly carried by dogs and bats. You may need a rabies vaccine depending on your circumstances. For example, if you're traveling to rural areas, doing outdoor activities, or traveling with children who may be more likely to approach animals. It's worth discussing at your travel health consultation so we can advise whether it's right for you. And if you want to know more about what to do if you're bitten abroad, we've written an article on exactly that. Now let's talk about mosquito-borne illness, specifically 3 diseases that are present in Mexico. Dengue fever is the most widespread mosquito-borne illness in Mexico. In 2025 alone, over 141,000 dengue cases and 85 deaths were reported across the country. It's transmitted by Aedes mosquito. This mosquito is a daytime biter. It is most active in the hours after sunrise and before sunset, so the common advice of covering up in the evenings is simply not enough for dengue. You need protection throughout the entire day. Symptoms can include a high fever, severe headache, pain behind the eyes, intense muscle and joint pain, nausea, and sometimes a rash. Most people recover fully with rest and fluid, but severe dengue can lead to serious complications requiring hospital treatment. If you become unwell during or after your trip, always tell a healthcare professional exactly where you've travelled. There is a dengue vaccine called Chikungunya, which is available in the UK. However, current UK guidance only recommends it for certain higher risk travellers, specifically those who have previously had confirmed dengue infection. If that applies to you, raise it at your travel health consultation and we can advise whether it's appropriate for you. Zika virus is also spread by the same Aedes mosquito and is present throughout Mexico. For most healthy adults, Zika is a mild illness. Symptoms include a low-grade fever, rash, or joint pains. And many people have no symptoms at all. However, the risk Zika poses during pregnancy is severe. The virus can cross the placenta and affect the development of an unborn baby's brain, causing a condition called microcephaly, along with other serious neurological complications. There is currently no vaccine for Zika. If you are pregnant or planning to become pregnant, it's crucial that you get travel health advice before traveling to Mexico. Chikungunya is perhaps the least well known out of the 3. Cases have been reported across multiple Mexican states and it's spread by the same Aedes mosquitoes. The defining symptom is severe joint pains. Some people may struggle to walk or carry out daily tasks. What makes this particularly relevant for World Cup travellers is that symptoms can take some time to develop. And joint pains can persist for months after the initial illness, so someone could return home feeling fine and then develop symptoms weeks later without connecting it to their trip at all. A vaccine is now available in the UK for chikungunya, though suitability depends on your age and medical history, so speak to our team. For all three of these diseases, the prevention strategy is the same: strict bite avoidance. Use insect repellent containing at least 50% DEET on all exposed skin and reapply it regularly throughout the day, especially if you're sweating in the heat. Wear loose, long-sleeve clothing. Stay in accommodations with air conditioning or window screens where possible. And please don't underestimate how important this is. Beyond mosquito-borne illness, travelers' diarrhoea remains one of the most common health problems affecting visitors to Mexico, and it's almost entirely linked to contaminated food and water. Clinically, it's most commonly caused by bacteria such as E. coli, Salmonella, Shigella, though viral parasitic infections can also be responsible. The reason travelers are particularly susceptible is that they haven't been previously exposed to local microbial strains, meaning organisms that can cause no illness in local residents can cause significant gastrointestinal symptoms in visitors. Tap water in Mexico is not safe to drink, but the risk goes further than most people realize. Ice may be produced using untreated water. Salads, fruits, raw vegetables may also be washed in it. Even brushing your teeth with tap water can occasionally cause illness. Stick to bottled or properly purified water throughout your trip and be cautious with ice and raw foods. Symptoms typically develop suddenly and includes loose or watery stools, abdominal cramping, nausea, vomiting, and sometimes fever. Most mild cases resolve within a few days with rest and proper hydration. Stick to simple foods like rice, toast, or plain bread while recovering, and avoid heavy, fatty, or dairy-based foods. In more severe cases, particularly if your symptoms are prolonged or if there is blood present, antibiotic treatment may be needed. This is worth discussing at your travel consultation, as some travelers benefit from carrying standby medications, depending on their destination and medical history. Mexico in June and July is extremely hot, and heat exhaustion is a real risk, particularly if you're spending long hours outdoors at matches or fan zones. Wear loose, lightweight clothing and apply SPF 30 or higher sunscreen regularly, and drink bottled water consistently throughout the day. One thing people underestimate is how much faster alcohol dehydrates you in high heat. Be mindful of that, especially on match days. Finally, large crowds mean a higher risk of respiratory infections spreading through close contact. Crowded stadiums, fan zones, airports, public transport all create environments where airborne and surface transmission is easier. The same basic habits apply. Wash your hands regularly, especially before eating and after using public facilities. In busy World Cup environments like crowded stadiums, fan zones, public transports, hand sanitizer is one of your best tools. Mexico is going to be an incredible place to be this summer, but the travelers who enjoy it will be the ones who've prepared properly before they flew. Golden rule is simple: don't leave your travel health appointment until last minute. Some vaccines take weeks to become effective, some require multiple doses, and the World Cup starts on the 11th of June. If you haven't booked yet, now is the time. I've written a full guide covering everything we've discussed today: vaccines, mosquito-borne illness, food and water safety, and many more. The link is in our bio, and if you'd like a travel health advice based on your specific trip and medical history, you can book a consultation with us at Health Klinix.